Hi all, welcome to competitive pharmacy. Today we are discussing chapter posology. Posology derived from the Greek word posos, that means how much, and logos means science. Posology is the study of dose calculation, branch of medicine or pharmacy dealing with doses. Pediatric dose calculations. Posology is mainly used in pediatric dose calculation based on the age. There are different formula for calculating pediatric dose based on the age. First one is Young's rule. For calculating dose for children of 12 years old age, we are using Young's rule. For calculating dose for a child in Young's by using Young's rule, dose for a child is equal to adult dose into age of child divided by age of child plus 12. Dose for child is equal to adult dose into age of child divided by age of child plus 12. So up to 12 years of old dose calculating, we are using Young's rule. Next is Cowling's rule. These are used for calculating dose for children of 2 years of age or older. The dose for child is equal to adult dose into age at next birthday divided by 24. So suppose the child is having a 5-year-old, now he is 5-year-old, and we are calculating using Cowling's rule. How it can be calculated is adult dose, suppose it is X gram, adult dose into age at next birthday means now the child is 5 years, next birthday is 6 divided by 24. This is Cowling's rules. Next is Freud's rules for infants. For calculating dose for infants, small babies younger than 1 year of age, we use Freud's rule. Dose for infant is equal to adult dose into age in months divided by 150. Next is Billings rule for calculating dose for to 20 years age. Dose for child dose is equal to adult dose into age in years divided by 20. So these formula are for calculating dose for a child when adult dose is given based on age of the child. So let us see some of examples. First question, date of birth of a child coming to the OPD of a hospital is 2/12/2016. His date of hospital visit is 28/12/2020. The child is prescribed with a drug having an adult dose of 480 mg. Calculate the dose of drug required by the child using Cowling's rule. So here the child date of birth is 2/12/2016. So his age is 5 years or 4 years old. 2016 to 2020 is 4-year old. So when he visits the hospital of his OPD, he is 4 years. So the next birthday, how is dose calculating using Cowling formula is adult dose into age at next birthday, divided by 24. So next birthday the child will become 5 years. So adult dose is 480 into 5 divided by 24, 100 mg. So the child required 100 mg of drug. So calculate this using Young's formula. How? By using Young's formula, the dose will become 120 mg. So 480 into 4 divided by, how is Young's formula? What is Young's formula? Young's formula is adult dose into child age divided by child age plus 12. So child age is 4, child age plus 12 is 16. So 4 plus 12, 16. So 480 into 4 divided by 16, 120 mg. Hope you clear? Next question. Using Young's rule, calculate the dose of child required by a child of 8 years old, even that the adult dose is 360 mg. So Young's formula, adult dose into child age divided by age of child plus 12. So 360 into 8 divided by 20, 144 mg. Next question. A 14-year child came to hospital OPD and he is prescribed with a drug which has an adult dose of 400 mg. Calculate the dose required for him. So the child is 14 years old. So the most appropriate formula is Dilling's formula. Dilling's formula is based on age 4 to 20 years of age. So Dilling's formula, how the dose calculation by Dilling's formula, adult dose, child dose is equal to adult dose into age of child is now, this is 14, in question it is 14 divided by 20. So 280 mg. So 400 mg of adult dose. The child dose required is 280 mg using Dilling's formula. Next, a baby of 6 months is prescribed with a drug having adult dose of 500 mg. Calculate the dose required for him. So, for an infant, dose calculation is Wright's rules for dose calculation. Formula is child dose is equal to adult dose age in months. Here age in months divided by 150. Here 6 months old child is given. So adult dose is 500 mg. 500 into 6 divided by 150, 20 mg. So the child need only 20 mg of drug. So we have finished dose calculation based on age. Next is dose calculation based on body weight. So for that we have used class rule. In class rule, child dose is equal to adult dose into weight in pound divided by 150. Suppose the weight is given in kilogram. 1 kilogram, you have all know, is 2.2 pounds. So child dose is equal to adult dose into weight in kilogram divided by 70. So when it given in pound, divided by 150. When it given in kilogram, divided by 70. Don't forget that. No need for forgetting, because you have all know 1 kilogram is equal to 2.2 pound. So substitute it in equation, we will get this. Child dose is equal to adult dose into weight dose in kilogram divided by 70. Okay, moving to the question. A child is having a weight of 75 lbs pounds. Calculate the dose required by him if the adult dose is 500 mg. So formula is what? Class rule. adult dose into weight in pound divided by 150. So child dose is equal to 500 adult dose into weight in pounds 75 divided by 150, 250 mg. So a 500 mg drug, the child dose required is 250 mg. So next question, child is having a weight of 21 kilogram. Here it is given in kilogram. So formula we have to convert it like that. Calculate the dose required by him if the adult dose is 360 mg. So the formula is class rule, adult dose into what? Sorry, weight of the child in kilogram into adult dose divided by 70. Okay, that is 108 mg. So we have finished dose calculation based on age, based on body weight. Next is based on body surface area. So based on body surface area, child dose is equal to adult dose into child body surface area divided by average adult body surface area. So average adult body surface area of a 70 kilogram adult man is 1.73. This you have to remember, 1.73 meter square. So formula resultant formula is child dose is equal to adult dose into child body surface area divided by 1.73. Calculation. Calculate the dose for a child whose body surface area is 0.52 meter square if adult dose is 400 mg. So our formula is child dose is equal to adult dose into child body surface area divided by 1.73. So 400 is the adult dose, child body surface area is 0.52 divided by 1.73. We will get approximately 120 mg. So the adult dose required is 120 mg. So we have finished dose calculation of child dose based on body surface area, weight of child, next age of child. Okay, so age of child we have Young's formula, Cowling's formula, Dilling's formula, Dilling's rule, Freud's rule. So Young's formula, age of child dose is equal to age of adult dose into age of child divided by age of child plus 12. Cowling formula, adult dose into age at next birthday divided by 24. Dilling's rule, adult dose into age of child divided by 20. Freud's formula, based the infant dose calculation, so age in months divided by adult dose into age in months divided by 150. So based on body weight, Clark's formula, Clark's rule, age of child in child, sorry, not age of child, weight of child in pounds divided by 150 into adult dose. When it is given in kilogram, weight of child in kilogram divided by 70 into adult dose. So body surface area, the dose of adult dose into body surface area of child divided by 1.73, that is adult body surface area. So we are all finished. There is formula for calculating dose or pediatric dose calculation. Suppose the question is given as now adult doses for previous questions, all questions we have seen adult doses 500 mg or 360 mg, like that. Now, suppose you are giving a dose per kilogram. Suppose 460, the dose is given 460 microgram per kilogram. Then how can we can calculate the dose? The dose is calculated based on adult dose, adult body weight, that is 70. We all know the adult body weight is 70 kilograms. So suppose per kilogram you are giving 460 microgram, then how can we convert it to adult dose? 460 into 70. So calculation is based on this 460 into 70, that is adult dose. Hope you clear this portion. Uh, if you like this video, please like, share and subscribe. Thank you for watching. Have a nice day.